Hey everyone, this is Rich. I'm joined here today with my friend Dr. Suzanne Fox, and
Hey guys.
we're honored to have Dr. Sandra. I hope I said your name right.
Musial.
Musial. Okay, and she's been running PlantDocs. How long has it been
It's been
since you
five
started?
years. We started
Five
it.
years, and it's an awesome initiative. I checked out her website, and I recommend our viewers do that as well. She works out of Providence, Rhode Island. You see people virtually as well, correct?
Correct, from all over the country.
So my first question is, can you discuss your transition? Because you started out in the pediatric practice, I believe, right?
Correct. Yeah. So when I trained to be a doctor, I decided that pediatrics was the path I wanted to go down. And I did private practice for 13 years. And toward the end of that, I started learning about plant-based nutrition. Some of my patients were asking me about it after reading the book, The China Study. So that's how I entered the world of plant-based nutrition. And then I decided I wanted to kind of do something a little more academic. So I moved over to Hasbro Children's Hospital, which is the Brown University teaching hospital for pediatric residents and medical students. And I worked there for 11 years. And during that time, I was kind of growing my self-education on nutrition, because as most people know, doctors do not get much, if any, nutrition education in medical school. Even though I did have an undergraduate degree in nutrition, that was many, many years ago. And I was learning this new information about whole plant-based nutrition and its impact on human health. And I felt like the world of pediatrics wasn't aligned with kind of the most cutting, up-to-date knowledge. We were still pushing milk to children and juice as a form of fruit. And I just felt like things were lagging behind. So while I was there, I opened a pediatric obesity clinic with another physician. And in order to kind of up our credentials, we got board certified in obesity medicine. And that was really cool because it was 80% adult medicine and only 20% pediatrics. So I was starting to feel like, maybe I could start helping adults out here. And there were two reasons why I was super motivated to do that. One was after reading the China study myself, I gave it to all my siblings and a lot of other people, whether they wanted it or not, because I just felt like, oh my God, I need to share this knowledge. But my brother Steve read it and immediately changed from a standard American diet. He was kind of a meat and potatoes guy, kind of sedentary. His weight was 50, 60 pounds overweight. He had high cholesterol. He had high blood pressure. And I didn't know this because he lives in Colorado. His doctor had recently seen him and wanted him to start on a bunch of meds. And he really didn't want to do that. And at the same time, his neighbor dropped dead of a heart attack, who was in his 50s. So it just kind of came at the right time in his life. And he read the book and it's changed his life. He's been whole food plant-based ever since. But I started
I love
thinking,
that. That's a great story.
right. And
Yeah,
I thought, my God, one book can change someone's life and health and make such an impact. And I'm feeling like these are my, people in my age group now. And I just started feeling this passion to want to help them. And the second reason that was very powerful was a good friend of mine dropped dead of a heart attack. And I felt like it could have been prevented had he. I really believe if he had known, of course, most people, right? If they know they're going to have a heart attack, they would change the course in their life. And so I felt like this kind of mission or passion to help people not have heart attacks and not get cancer. And the world of prevention has always been a big passion of mine. And I just started going down that avenue.
great. Suzanne?
I love hearing that because that's so important. So did any of your other siblings get on board with that, or is it just straight up just that one brother?
No, everybody has
Oh,
drunk
that's
the
great to hear.
candy Kool-Aid. So my sister and my niece, I brought to Kerpalo to hear for a weekend. We Dr. Esselstyn, his wife, Anne, and Colin Campbell were doing a weekend. And so I went with the two of them and my father-in-law, and everyone was like, yeah, this is amazing. Why doesn't everybody know about this? My other brother and his wife are plant-based. No, everyone. I gave it to my father, and he actually was, he's actually the reason I study nutrition. He's kind of very forward thinking um in his knowledge about nutrition, because his brother died of a heart attack when he was in his 40s. And so
Wow.
my father, and this was way back in the 80s or 70s, like my father self-educated. And so when I was in high school, my dad was informing the family, like, let's stop eating red meat, or let's, so, what they knew back then, let's stop eating butter. Let's stop frying the chicken in like 6 inches of oil. So like, and that awareness made me want to study nutrition.
Yeah, he
But
sounds like a great dad.
yeah, and he was actually doing the best he could, but he was still eating fish and oils, and but a lot of fruits and vegetables, but he couldn't get his LDL down, and his doctor just wanted to put him on a statin. And my dad and I had given my dad this book as well, and so he said, I'm going to try this, and it worked. He went off of fish and oils and brought his LDL down, that's the bad cholesterol, into a healthy range. And so, yeah, it's kind of contagious when you, I don't know,
Yeah,
it's my circle of family and has really kind of caught on, and we're all on board with it.
I've had the same experience with my family. Well, part of my family. I think I probably told you that my mom reversed her diabetes with a whole food plant-based diet. It works.
Awesome.
Feels great
Amazing.
that you can, turn another family into this lifestyle. So
It really
Yeah,
I'm
is.
really happy to hear that.
I'd
So
like to figure
rewarding.
out how to increase the contagiousness of it.
Definitely. So I think you were a vegetarian for years, if I remember correctly. Um, how many years do you think
Oh gosh.
since your teens?
The the China study I read probably 15 years ago or more at this point,
But you
maybe.
were a vegetarian before that,
I
right?
was kind of a vegetarian on and off since forever, because I never liked eating meat ever. Even as a kid, I hated hot dogs and hamburgers, but that was all, you eat what you're served, and there was always meat and cheese on the plate. So and then I tried becoming a vegetarian when I was in my 20s, and I was pregnant, and I was probably doing it all wrong, right? I was eating like white pasta. I was not eating whole grains. I didn't have the
Yeah.
education to do it properly. So I think I was nutrient deficient. And when I was pregnant, I was just craving meat. So I started eating meat again. But once I figured out how to do it right, of course, you don't crave meat.
Right, right. Yeah, I
I
don't
think
crave it at all.
even calories, isn't it? Mostly doing is just they haven't eaten enough calories, basically. That's
Exactly.
what
I
the
think that's why a lot of
craving for
vegans
animal
go
products seems to
back.
come based.
I
Yeah,
probably
I think a
wasn't
lot
getting
of
enough.
vegans go back because they're not eating enough, in my opinion. So that's why they think they're craving meat, but it's probably more food.
I was probably not, I wasn't getting the leafy greens and probably the important
Mm,
sources of iron. I probably wasn't eating legumes. I don't know what I was eating. I was probably eating like fruit and broccoli. That's all good, but I just wasn't getting the whole grains, the legumes, and some important iron sources.
right.
Yeah.
I'm glad you figured it out. And it's easy, right?
Yeah,
Once you have it down to a science, I
yeah.
mean, it's easy to me anyway. So was curious what led you to start PlantDocs.
Yeah. So that kind of helping adults, that desire, that I was
Yeah,
just like, how can I do this professionally if I'm a pediatrician? That was my biggest conundrum for years. And I decided, I guess what happened was I met Kim Anderson, who's the owner of Plant City, which is this plant-based food hall in Providence. And she was, before it opened, she was like, it would be, really cool to have some doctors in the basement. They have this community space in Plant City Cellar, where they do like yoga classes and cooking classes and movie nights. And, she was like, maybe you could, run something there. And that was all. That little seed was planted. And I was like, that's what I want to do. I don't know how, but I'm going to figure out how to do something with adults. So I recruited 2 other family physicians who were legit adult doctors who were passionate about lifestyle medicine. They had been to a couple of lifestyle medicine conferences, and they were really jazzed by how impactful changing your lifestyle can be to all these chronic diseases. And together we started PlantDocs in 2019. And at that time, it was just like a sidekick thing that we were all doing. It was in the evenings, like once a week. We would gather a group of 20 people for a month, and we would educate them on plant-based nutrition, teach them how to cook, shop. We would get labs before and after. And after the first month, we were all sold on it because we saw these crazy, results in dropping LDL and improving diabetes, lowering inflammatory markers, reversing fatty liver. And, especially the adult doctors, they were like, we never see this, like,
Yeah.
it's some of it works better than the medication. So we were all just really excited. And then, so we just decided, let's keep going. So we did like another one, and we started this business. And then this was in 2019. So COVID hit, and we had to shut down in the middle of our 6th jumpstart. And everyone did COVID stuff for a while, which was no fun.
Nope.
But it gave me pause to reflect on what was really important in my life and my career. And I quit my job I gave notice in January of 21. I took a month off. I went to this cabin in the woods in Vermont, like in January. If anyone knows Vermont in January, you're lucky if it reaches 5 degrees Fahrenheit.
Yep. Yep.
And I had this wood stove, and I was like cooking and making cooking videos, and I was probably there 3 days, and I was like, it's crystal clear. Like I just needed a break from everything to just have so I just called my boss and gave notice, and which we teach the residents and the medical students. So I gave notice for the end of June because that's like when they switch over. And then from then on, so from July 2001 till now, I've been full-time just growing PlantDocs, switching it over to a nonprofit, taking business classes, hiring people to support me so I can do more of the doctory things and less of the organizational stuff.
Yeah, it's a great website too, and I love what you're offering.
Yeah, and it's all kind of layered on. So we started with these jump starts. And the other really cool thing that happened as a result of COVID was that we started offering things remotely because we didn't want people coming in that were exposed to COVID or had sniffles. Right. We were like, please stay home, because it was so touchy at that point. Remember, it was like, gathering people together was dicey. And then the last thing we wanted to do was all eat together with masks off. So we started these remote cooking together classes where everyone would cook in their own home, and we would only gather for the educational piece. And I had people that had done more than one jumpstart that gave us feedback like, this is fantastic. Like, it's so much better. Instead of just watching someone cook and do a demonstration and then eating it, it's so much more empowering to have to buy the food and cook it yourself in your own kitchen. So,
it's a good way to learn too.
Yeah. So based on our feedback, we just keep kind of morphing the program into what is the most effective and most fun and most educational for the people. And then people were saying we need more cooking classes after we graduate. Like, how can we stay in touch? So then we started these monthly cooking classes that were all remote. And we had people asking me like, I want to do it all remote. I'm calling from New York City, and my sister did it and I want to do it now. So then we started offering it fully remote. So that was great because, right? Why do you have to just be a Rhode Islander to benefit from this? So we started taking people from all over the country. So that was fantastic. And I started doing consults after I quit my job that are really, MD level nutrition consults. And this year we're getting into the corporate world.
Great.
Oh, even better. That's really nice. That is so good to hear. Sounds like you guys have really taken off there.
Yeah.
How many doctors do you have working with you right now?
So I think we're at 4 now. People, there was one resident who's wonderful who worked for us for 3 years, but he's just left. And then there's a couple new people that have come in that are passionate about it. So that we're at 4 right now.
Good. That's awesome. So good to hear. Because that's always a challenge. I know just for me personally, when I go see the doctor, they just take a look at all the numbers. They go, oh my God, how did you get these numbers? And then they just then they quiz you. Do you eat fish? Do you eat dairy?
Yeah.
Where do you get your protein? They're like, well, anyway, on to the next very sick patient. And that's how it'll go,
Yep.
Right.
Yeah, so having access to a plant-based doctor makes all the difference in the world. Yeah.
It really does.
Yeah. And last year I discovered, I discovered it long before that, but the American College of Lifestyle Medicine, I had been to one of their conferences, probably like 8 years ago. And I was like, these are my people, a bunch of doctors and practitioners and healthcare providers that are all looking at the evidence behind diet and exercise and stress reduction. And I was just like, I didn't even know this existed. So I finally did my board certification last year. So I'm now board certified in lifestyle medicine, which
Nice.
also a lot of
Nice.
adult medicine. So I felt like I added that to my, since I'm only really working with adults at this point. I wanted to have that, but yeah, I learned a lot, but I also was like, why doesn't every doctor have to have, this isn't like, it's like called a subspecialty, but really it's every doctor should know everything
Exactly.
in lifestyle.
100% agree. Yeah.
It's kind of silly, but anyway, it was
is.
funny. As I was studying, I'm like, really? Why is this not just in every medical student's education?
I don't know if you communicate much with other doctors, but are they impressed with the results you're getting, and
Yeah.
are they on board with the plant-based diet?
Yeah, I mean, there's a lot of education that needs to be done. So the people that are educated, that have been to an ACLM conference or other lifestyle medicine conference that are, have opened that door to kind of consider the impact lifestyle medicine can have on medicine. Those people, yes, they're interested. But then there's like a group of doctors that just aren't in the know, and they're buried in work and charting and they're doing this with, this is what I learned, this is what I'm practicing, and I don't know if they don't have time, but so I feel bad. Like I think it's going to be a generational thing, like as more medical students are getting slowly
I think you're right.
this, then they will grow up to be doctors that are better informed about the importance of lifestyle medicine and prevention. But we have a lot of work to go still in the medical school.
It takes time.
Yeah, they're not even at Brown. Like I help teach this class called Food and Health, and they take 20 students each semester, and they learn about the importance of food and health, and they learn to cook at Johnson & Wales University. But it's not everybody, so if 20 do it twice, so it's probably like a third of each class does it.
Good.
Yeah. I mean, I think we're making strides every day, but we're not exactly where we want to be yet. But I think we'll get there.
Yeah, we're all at that. This is how I think about you guys and me. We're at like the front of this wave, and it's going to happen, and it is coming.
Yeah, I agree.
It's inevitable. The data is rock solid. The chronic diseases are out of control. And this is the answer. And it's simple and it's cheap. So like,
Yep.
I don't understand why it's not a tsunami, but we're at the beginning of that wave and we're helping to spread the word, but it's gonna catch on.
Yeah, I think so too.
And why it's taking so long.
There's a lot of resistance.
There
Huh?
is a lot of resistance. Yeah,
Yeah, people don't like to change their
that's the
diet.
trouble. That's the trouble. Yeah.
And ironically, our diet did change over like 3 or 4 generations from being, much healthier to being like complete crap. So
Yeah, good point.
we
Very good
can go
point.
back, but I think it's gonna, we gotta clean up the supermarkets and
Yeah, yeah. And plus, peer pressure too, and colleagues bringing in junk food and family, and we have a long way to go, but we'll get there.
we sure do.
I just have a few more questions. The first one is, I think you already touched upon this already, but what are your views on how plant-based nutrition can preserve health and reverse chronic diseases?
Well, my experience has been that it has a profound impact on lowering LDL and total cholesterol and triglycerides, which, the LDLs alone are an independent risk factor for heart disease and developing plaque in the coronary arteries. So huge impact on heart disease. And heart disease is the #1 killer in America. Someone dies of a heart attack every 40 seconds. So I think it's like, that's just huge. It also, I've seen people's blood pressure go down. Sometimes in just 1 month, we definitely see incremental improvements. But I had one woman come in to one of our jump starts, and we always take the people that are live in person, we take their blood pressure in the room and weigh them and calculate their BMI, and then everyone leaves with a lab slip. But her blood pressure was like 200 over 100, something
Oh my God.
high. And my partner, the family practice doc, was like, I don't know what to do with this. She's like, if this woman walked into my office, I would send her straight to the ER. And the woman was like, I'm not going to the ER. And I've tried medications. I've tried 3 or 4 of them. I have terrible side effects. I'm not taking this. I want to do this. I want to do diet, and I'm going to be like your best patient. And, she was also overweight, high cholesterol, had the picture of, the results of unhealthy eating over, decades. So at the end of the program, she was down to like 190 over like 90 or 80. So she was like going in the right direction. And
Getting there.
we all just like crossed our fingers, like, oh, she's going to be okay. 3 months later, she sent me a picture of her blood pressure cuff with 120 over 70. And I
Oh,
get
wow.
goosebumps still. I was just like, that's what keeps me going. When
Yes,
people like
I love
learn
that.
about it, stick with it. And that's what it takes. It takes a little bit of time for all this food as medicine to, bathe the endothelial cells, breakfast, lunch, and dinner, and snacks, and help heal. It's like a healing process after years of just insulting food and
It
damaging
is.
food. To see her blood pressure come down just with food, it's so rewarding.
I love
And
it.
of course,
And I
sorry,
was just going to say, it's amazing thing that body can heal even after years of abuse.
right? I
And
know. It
and I'm a
can.
living testament to that as well, because my blood pressure was sky high. I think it was like 150 over 100 or whatever it was. And now I'm getting like 95 over 65. It's
Yay.
crazy. Yeah.
And what you said about your mother, I mean, that's the other really important disease we're tackling. I
Yeah.
love that. And I'll just tell you one other story. We had this woman who came in. She was really nervous because she was switching from the classic kind of going out to Dunkin' Donuts in the morning, getting a coffee with cream and tons of sugar and a roast sandwich and, just an unhealthy American diet, to like learning how to cook. Never didn't know what a whole grain was, didn't know how to cook kale. So she was really like far apart from where she was to where we were going. So she made a consult with me ahead of time, 2 weeks ahead of time, and said, I want I need more handholding. I need more assistance with this before we get started because I'm nervous I won't be able to do it. And she had type 2 diabetes and high blood pressure and high cholesterol and was overweight. And so she decided the first thing she wanted to do was just cut out meat and cheese and nothing else. She didn't want to try to figure out how to cook grains. That was like, I'll wait for the program for that. And before the program even started, she needed to cut back on her insulin. And it just was like so mind blowing. Like we haven't really done a ton of education, just that small change. Her cells started working again. Her insulin started working. She didn't need as much of this injected insulin. And we see it all the time, but like 1 week later into the course, we needed to lower it again. And 1 week later, we needed to lower it again. And her endocrinologist didn't believe it and was like, she had a dance class she started going to, and her blood sugars started dropping too low. And the endocrinologist wanted her to take some extra glucose before the class rather than reducing her insulin. And I was like, no, like that's not they didn't believe that she was actually improving and healing herself. But
I know doctors just don't believe, you can cure diabetes.
No.
Unfortunately.
It's crazy.
Yeah. I did have one last question, unless Susanna has another one, but I wanted to ask, about your services and how people can contact you and just if you can give more information about what they can find on your website.
Sure. Love to. So we're PlantDocs. So our website is PlantDocs, DOCS.com. And that's also our Instagram and our Facebook, PlantDocs.
That's a great name, by the way.
Thanks.
I like that name.
We also have a YouTube channel with cooking videos, educational videos. It's kind of expanding. Actually, I started that at that Vermont cabin in the woods. That one is PlantDocs PVD, as in Providence. I'm trying to get the other PlantDocs name back, but and we have the Jumpstart Your Health. That's the name of our 1-month program with the labs before and after. We run it 4 or 5 times a year. So the next ones are in September and November, and it's $350 for the month. And it's 5 sessions, a private consultation afterwards. There's an exercise class. There's a shop with a doc that can be done. And all of it can be done fully remote or part in person for the education on weeks 1, 3, and 5. And then all remote on weeks 2 and 4 over Zoom. So that's our Jumpstart Your Health. And then we have a cooking class.
Is the Jumpstart a 6-week program?
You cut out. It's a 5-week program.
The Jumpstart, is it a 6-week program?
5 weeks.
5 weeks.
Okay. Okay, I just wanted to know.
Yep. So then we also have monthly cooking classes that you can just do one, or you can buy a package of 3 or 6 to, for reduced rate. And those are once a month on a Sunday from 5 to 6:30. We send out the ingredients and we all cook together. And there's always a theme. So last year it was global cuisine, and we traveled around the world virtually learning different recipes. This year it's all been about healthy aging and longevity. So I always do a little talk while something's cooking with a topic on longevity that might be related to exercise or stress reduction or the food that we're eating. We talked about grounding and walking and forest bathing when we were doing some Asian food. So
Nice.
I try to keep it fun and interesting. And then I offer private consultations that can be done remotely or at Plant City. So whatever people want and need. And we have corporate offerings that we're just creating now. And we've done a bunch of things, but I haven't got into like a regular groove with that. I'm trying to see where we're going to land. But the latest thought I had was creating a course for corporations where their employees are thinking about going on those GLP-1s like Ozempic or Wegovy. And I would create a plant-based course that they could take before going on to see if we could reduce their numbers and not need the GLP-1. So it would, you know, would save them going on these medications with horrible side effects. That really isn't a sustainable solution to the problem. And it would save the companies lots of money. So
That's great.
latest thought.
Yeah, definitely. I still want to check out Plant City one of these days too.
Let me know if you come to Rhode Island and we'll have lunch together.
Definitely. That's all I have, but I really appreciate your time and doing this interview. And I recommend our audience check out your website for sure. You do offer a lot, and I wish you much success.
Thank you. Yeah, on the website, there's a lot of recipes too. So they're all free, you know.
I'll check them out myself too.
Yeah, they're all good.
Oh.
Let me know what you like.
Sounds good.